This is Dealing with Difficult Patients 101. This video is brought to you by yours truly. We are going to first introduce this topic with some stats. Fortunately, research is plentiful, with many published pieces stating that on average 50% of patients are considered difficult to deal with. Additionally, 1 in 10 coworkers are considered difficult to deal with. Almost always, that one coworker is named Brendan Sullivan. But fortunately, these statistics are not backed by research. But seriously, it begins day one for me, whether or not I know if they are difficult, and that is to 1, learn their style of learning and doing. That could mean asking or simple observation. With asking, it could be as simple as asking, what's the best way you learn? With observation, I sometimes notice a patient learns better when I first show them how to do it. Monkey see, monkey do. Not that any of my patients are monkeys. Besides being a guide for graduate school, fake it till you make it for me means not taking anything personally. The bigger picture being not letting my emotions get to the best of me. With that, maintaining professionalism is always key, knowing the difference between right and wrong and stating that or reporting it. Personally, there were many times where I've been hit on in a healthcare setting and I've had to report it, or where I was asked to give an opinion on politics and I declined. Secondly, caring for patients all around. I've noticed patients are a lot more adherent to me when 1, I know what I'm talking about, and 2, I care about their lives, even if I don't really care about some of it. For example, I don't care about you having to buy cat food after physical therapy. And as a side note, it helps if the caring is genuine too. This is probably the most effective one for me thus far, especially with a certain younger athletic patient I'd had while I was there. I'd noticed after many attempts of suggesting, educating, or telling this patient what to do and why, he seemed indifferent. Throughout the sessions, I'd noticed that he would always request if we could play the Wii, to which of course I agreed, but it came with stipulations. I agreed that he could play only if it incorporated some of the exercises I wanted him to do, such as a single leg balance. Secondly, I knew that he loved football, so I incorporated some exercises with a ball throwing activity also. And that pretty much sums my approach with difficult patients. Learning their style, fake till you make it, letting nothing affect me and caring for the patient always, and finding a common ground or their passion. Lastly, I just wanted to say I miss you all, and special shout out to Jules and baby girl Kelly Marie.